Welcome to another video. In this video, we will continue learning medical surgical nursing starting with mechanical ventilation. Mechanical ventilation provides respiratory support through the controlled delivery of ventilation and oxygenation via an endotracheal tube, tracheostomy tube, or non-invasive ventilation via mask through continuous positive airway pressure or bilevel positive airway pressure. There are three main reasons to use mechanical ventilation, which are: during surgery, acute respiratory distress, respiratory failure. Let's talk about how to care for a patient with mechanical ventilation. As a nurse, here are your tasks. Explain procedure to client. Establish means of communication, such as asking yes/no questions, providing writing materials, using a dry erase board and/or a picture communication board, or lip reading. Maintain patent airway. Now, maintaining a patent airway is crucial to know for nursing exams. Let's go over the ways to maintain a patent airway. As the nurse, you will need to ensure advanced airway devices are secured. Assess position and placement of tube, document in centimeters at the client's lips or teeth. Prevent accidental extubation. Suction oral and tracheal secretions as indicated by assessment. Assess respiratory status every 1 to 2 hours and as needed. Maintain adequate but not excessive cuff pressure. Less than 20 mm Hg is recommended to reduce risk of tracheal necrosis. Monitor ventilator settings and alarms. Never, ever, turn off ventilator alarms. If the cause of an alarm cannot be identified and corrected, and the client's respiratory status begins to decline, the nurse should ventilate the client using a manual resuscitation bag until the issue is resolved. Now let's talk about the different ventilator alarms you should be aware of. Low pressure alarm indicates low volume and is usually associated with tube disconnection, cuff leak, or tube dislodgement. High pressure alarm indicates increased pressure, which may be caused by secretions, kinking of tube, pulmonary edema, or the client coughing or biting the tube. Apnea alarm indicates there has been no spontaneous breath within a preset time period. Medications are sometimes given to patients. The common medications that are given are analgesics, sedation, and neuromuscular blocking agents. Next, preventing complications of mechanical ventilation. The first complication to note is pneumonia. This can be avoided with the use of proper hand hygiene, elevating the head of the bed, and oral hygiene. The next complication to note is pneumothorax. This is caused by high ventilation pressures. As the nurse, you will want to auscultate lung sounds frequently. If the patient displays sudden respiratory distress, this could be a sign of pneumothorax. Note that this requires immediate action with the use of a chest tube. That covers our lesson with mechanical ventilation. Let's now go over preoperative care. Starting with the preoperative phase. During the preoperative phases, procedures or teachings are completed before a surgical procedure to reduce potential complications and postoperative discomfort. The care of the client before surgery. There are a few tasks a nurse must complete before surgery. Those tasks include the following. Take client history. Identify risk factors such as infants, the elderly, chronic illness, malnutrition, respiratory conditions, obesity, emergent procedures. Check for informed consent. Perform baseline assessment. Assess allergies. Verify NPO status. Medications may be prescribed to the patient. The common medications include anesthesia, antibiotics, anticholinergics, narcotics, and sedatives. Before any patient goes into surgery, there are certain diagnostic tests that must be performed. Those tests include laboratory profile, chest X-ray, ECG, and most importantly, a pregnancy test for females. Important client education includes the following. You will want to address any fears and anxiety the client may have. Teach the patient to hold anticoagulants for 7 to 10 days prior to surgery. Examples of anticoagulants are warfarin or aspirin. Important to know are the common teachings a nurse must emphasize after all invasive procedures. You must teach the patient the importance of the use of an incentive spirometry. This will help prevent pneumonia and respiratory complications. If the patient is bed-bound, turn and position the patient every 2 hours to prevent bed sores. Perform early ambulation, including leg exercises. Well, that's it for this video. In the next video, we will continue the lesson by learning about the intraoperative phase. Thanks for watching.